I'm John Baksi. I'm a consultant cardiologist specialising in heart muscle disease and cardiac MRI at the Royal Brompton Hospital in London, where I was appointed as a consultant in 2013. While there are many ways to help people in small and large ways, I decided to become a doctor as this offered an opportunity to do that whilst indulging my fascination with the divine working of the human body in both health and disease, and also providing empathetic and compassionate care to a diversity of people, particularly at times when they may be in a vulnerable period of their life, but ideally to improve their health or the condition they're suffering from, or that of a relative. During my medical training, I'd always been fascinated by the heart and heart disease, and I chose to become a cardiologist because it offers opportunity to indulge that interest, but also to use traditional diagnostic and intellectual skills to make a diagnosis, but actually alongside a whole range of modern diagnostic techniques where we can quite accurately correctly make the diagnosis, identify problems, but also identify risk factors for future disease. Beyond just making a diagnosis and knowing what the condition is, most importantly, we have a huge range of treatments, particularly medications, but also procedures that can actually change the outcomes for people with conditions or with risk of developing conditions. I grew up on the Isle of Wight, where both my parents were doctors, and feel very privileged to have seen the sea every day during my childhood. I moved to London in 1994 for my medical training and have primarily worked and lived in London since then. I very much enjoy meeting people, but particularly having the opportunity to help them improve their health, both now and for their future, or the health of that of relatives. I'm fortunate to have very positive feedback from patients, which we're obviously encouraged to collect regularly, and themes that come out are they're very pleased with the openness I offer them, but particularly the thoroughness and the time I take to make sure they fully understand their conditions and go through the treatment options and implications. For me, it's a great privilege having access to the lives of patients at often very vulnerable times, and I really value the honesty they bring to the consultation. I think partly with an appreciation that the more open they are with us, the more correctly we can advise and help them.